Welcome back to another G&S Business Communications Inside Story. My name is Marjani Williams. I am a vice president here of DE&I and also client service. And I am joined by one of my illustrious colleagues, Emily Hirsch.
Hi, Marjani. Nice to be here. Excited for a chat.
So today we're going to talk about just some really interesting findings from a recent survey that we did around healthcare trends and sentiments. And we're going to build on some of our expertise around healthcare and just some of the interesting trends that we've been finding recently in our work with clients, as well as being consumers of healthcare.
Yeah, I find it to be a really interesting dynamic that we are, professionals helping advise our clients on healthcare communications, but we also get to see things from the other perspective as healthcare consumers, because we all are healthcare consumers at the end of the day. So that gives us a really interesting POV.
Absolutely. I think one of the biggest trends, and we can just jump straight in, is around consumerization. For a while now, we've been seeing just folks within the industry talk about how they're working to consumerize or, help improve the ease of use for healthcare and access for consumers. And so I'll give a brief definition before we jump in, but consumerization of healthcare is really about a shift in the industry's focus. So it's going from a broader market as a whole to a focus on the needs of individual consumers. And this shift has really led to a number of changes just in the way that things show up day to day in the clinical settings, but then also outside. But it's really a focus on more patient-centric care, how consumer-focused services are delivered, more personalized care, more control in the hands of patients. And what piques our interest is really the focus on marketing, especially.
Absolutely. I think one of the fun and interesting things to think about. So for our healthcare clients, they're obviously focused on delivering better healthcare outcomes, delivering better access, and equity are really important parts of that strategy. So we're really thinking about people's access to information when we come down to our perspectives on consumerization. People are looking for information online to make their healthcare decisions. I think we feel that personally. We're all looking for healthcare information online too. Like I do that on a regular basis. So we know that the overwhelming majority of people are looking for healthcare information online. And we know that they are looking to see about a condition they have, or, they might be looking to doing some research for a loved one, or thinking, does their insurance cover something, or how expensive is this procedure going to be? So we want to be really where people are, where they're looking for information online, and making sure that we're delivering the right tools, the right information for them to make their decisions. And one of the things we also think about at G&S Business Communications is how do we inspire people to take action? So if we give them the right information, how do we then also move them to take an action? And how do we make that process as easy as possible?
Yeah, that's such a great point, Emily. And you mentioned the process, but I think at the core of that process is really trust. And so how do we focus on not only informing people of what's happening or giving them the right information, but also helping to have them have some trust in, in the information that they're receiving. And so it's really no surprise that most Americans are finding healthcare information online. We want it fast. We want answers now. But only about 30% of folks trust that information. And so that's according to the recent survey that we did in September of this year. But there's a significant trust gap that healthcare companies are facing. And so what we also found in that survey is that accuracy and trustworthiness are the most important factors that folks are considering when they're receiving healthcare information online. And we know those are just really scratching the surface of issues around access. So it's not just about, whether I'm finding the right information, but there's some historical nuances in there as well. I mean, folks from different backgrounds, communities of color, many folks from rural populations have had to endure some negative healthcare experiences over the years. And many of these challenges still remain in some settings where folks are, under-resourced, or there's literally physically no access to healthcare for miles. So we really encourage our clients to take a holistic approach. And we know that the transparency and also just the way that folks are prioritizing the needs of consumers is really going to help them step into the next wave of building trust with consumers, but also increasing accessibility to information. So we're encouraging folks to be very open in how they're transforming, whether it's a digital transformation or just transforming the way that they're approaching these conversations with sensitivity. But then we've got to get a little creative as well. Like some of this is simple, but we've got to think outside of the normal boxes that we're normally in. Because people honestly, they don't want paternalism, and that's something that has been a long-standing critique of healthcare. People want the partnership, and so just from my experience, like I understand the need for folks wanting to go from being treated like patients to actually being heard as people.
Yes, I love that point because I really think it underscores the need to empower consumers in today's day and age and really actively listening to people. And one of the interesting things also is just like studies show that people who show up more informed, more empowered to their appointments have better outcomes at the end of the day. So making sure people are armed with that information before their appointments, they come in with the right questions, they know what they're looking for and are kind of primed for that information and that interaction with the doctor, it's just going to be a more successful experience. And a lot of tools that have come about more recently, like in the past few decades, even the past few years since the COVID pandemic, telehealth appointments, online record keeping like MyChart, all of that has really made a great impact in terms of access to information, in addition to kind of, again, knowing that people are searching for that information online. So we know that things are going to continue to evolve on a day-to-day and year-to-year basis. So, there is no one-size-fits-all approach or one solution that's going to solve this whole thing. It's really about staying in tune to what's going on in the communications landscape, what's going on with patients, using tools like social listening to see what's going on, what are people talking about, what are people looking for, and trying to find more information about. And sort of related to that is something that we have to probably discuss in today's day and age is misinformation and the rise of that as a factor as well. So knowing that things can really quickly go viral on social media, different types of information or trends, it's just something that our clients really need to stay on top of and be aware of, and thinking through also how to combat it, making sure that there is that trustworthiness, like you mentioned earlier, with their information so that we can start to combat either reactively or proactively react to that information.
Yeah, the landscape is going to continue to evolve. And so I'm glad we're having this conversation and really just looking at how we as communicators have such a critical role in the future of healthcare. The industry is going to continue to evolve and try to meet the needs of consumers, but we know that the future, it has to be built on a foundation of trust. It has to be built on consumer empowerment. And all of that is really bolstered by effective communication. So we're anticipating that communications professionals like us will continue to be trusted advisors to really help break through just the volume of information that's out there online right now, but to really help combat misinformation and help our clients navigate these complex challenges that are creating the barriers to access that are really going to impact the vulnerable populations, but also, the overall health and wellness of Americans in general. So I'm appreciative of our unique position as consumers, but also healthcare, communications professionals. And so I'm just optimistic in what is happening and the shift that's happening in terms of leaning further into consumerization because healthcare is so deeply personal to us, but to everyone, it impacts all of us. And it's important for us to have a system that works for everyone so we can realize those better health outcomes. So thank you so much, Emily, for having this conversation. And I'm just excited to see the feedback that we get and the continue just shift in the industry.
Yep, absolutely. Thank you.